Good afternoon. I'm Linda Haslam-Stroud. I'm a registered nurse from St. Joe's Healthcare in Hamilton, renal transplant, and I'm also president of the Ontario Nurses Association, which represents 55,000 registered nurses and allied health professionals, and also over 12,000 nursing students across Ontario. With me today is Lawrence Walter, our Government Relations Officer. In our written submission, we believe that there is a number of recommendations that should be considered that we believe are essential to keep us, the nurses, caring for our patients. You do know already that workplace violence is a growing concern for us on the front lines, and of course the risk of violence certainly in the healthcare sector is prevalent. There's much to be commended about Bill 168, and I'd like to acknowledge the addressing of some of the risks of violence and harassment in the workplace, certainly domestic violence spillover, the worker's right to refuse, and also the duty to address the risk related to the personal history of a person with violent behavior. And while there is much to applaud, there are two seemingly small but fundamental flaws that we believe need to be addressed to add to the value of this bill. Firstly, the definition of workplace violence, which says now the exercise of physical force by a person against a worker, is problematic. Not all workplace violence is directed at us, the worker, but the workers, the nurses, are involved in violent incidents as part of workplace violence. And we know that the government didn't intend to make workplace safe we know that they intended to make it safe, be it directed at a worker or whether the worker is actually caught up in the crossfire as part of our duties as nurses. The first fundamental flaw in Bill 168 can simply be corrected by amending the definition of workplace violence and amend the word against a person in the workplace to saying, presently it says against a worker, and we believe if it's amended to say against a person. We believe that that simple amendment will make employers turn their attention to really what the root cause of workplace violence is as patients, weapons, or adverse events take place. You may not have heard the news today, but we had a case of two gunmen coming to the Hamilton Health Sciences Corporation, the Hamilton General Site, and actually took a prisoner that was being cared for by that facility. So that gives you a little bit of an example of where it wasn't against me, the worker, but it was a person-to-person situation that was taking place actually with the police. Second, the harassment can escalate to violent behavior, which can cause physical injury. And in fact, at the inquest of Lori DuPont, our member and our nurse from Windsor, where she was murdered, expert witness, and you've heard from the previous speaker, Dr. Jaffe, he described the continuum of behavior by the perpetrator, which culminated in her murder. And during his testimony, he actually identified missed opportunities when steps might have been taken to prevent Lori's death. He talked about the very threatening and harassing behaviors, such as stalking, that fell short of physical violence and force, but which were recognized precursors to what actually happened and the physical force that ensued. In the proposed definition of workplace violence, the definition remains confined to the actual exercise or attempt to exercise physical force, and we believe ignores the threatening statements and behaviors at the high end of the harassment spectrum, such as stalking. And we believe that that continues to be a missed opportunity and could have been and is a missed opportunity in Lori's horrific death. Accordingly, we are proposing an amendment to the definition of workplace violence to address this second fundamental flaw, to ensure that the threatening statements and behaviors such as stalking are included in the measures and procedures to control workplace violence. We have proposed two alternatives to cover the threatening statements and behaviors in our submission, and it is found on page 4, and I won't go through it. You know, door 1 or door 2, we've given you two opportunities to take a look at it. In addition to these two critical changes in the definition of workplace violence, we are also proposing amendments to 5 other sections. First, in section 52.4 under the Act, we would like the Act to require employers to at least report to the Joint Health and Safety Committees and to the Union Workplace committees so that harassment at the high end of the spectrum is taken to the committees. So the committees can intervene if necessary by making recommendations to the employer, calling in the Ministry of Labor or whatever route needs to be taken. Secondly, we are also recommending an amendment in sections 32 to add, in consultation with the Joint Health and Safety Committee or Health and Safety representative, and employers must consider the recommendations thereof. In every other hazard in the Act, we have the benefit of being able to have policies, measures, procedures, controls, risks, investigation. The Joint Health and Safety Committee is consulted for all those other hazards. Why not this one? The amendments in Section 32, we believe, are really crucial to ensure that the same level of participation for the hazard of workplace violence as for all those other hazards, as I mentioned. Thirdly, we are asking for an amendment to sections 32(2) to include the words, and you might think that they're minimal, but to include the words training and education programs. It presently says information and instruction. The current bill says information and instruction versus the phrase education and training in the healthcare regulation. We want to ensure the same level as we currently have in the healthcare regulation of the Act regarding education and training for the hazard of violence is included. We believe presently as it stands, it actually is watering down what we already have. Fourthly, we are asking the language used in Bill 168 to assess the risk of workplace violence raises concerns regarding the use of the word risk versus hazard. And if I can explain a bit further, because it is somewhat complex, we need language that requires the employers to assess if there is a risk to the hazard of violence. And what we're basically saying is presently, we only need to have the employers obligated to look at the risk. We want to eliminate the hazard. So we're suggesting amendments there, and you'll see them in our document. Fifth and lastly, the hazard risk assessment under Section 32 should also be provided so that the Joint Health and Safety Committees receive the information in writing. Doing so will provide the committee with concrete evidence that an assessment was actually conducted, and will give the committee a baseline to analyze the assessment and make recommendations to the employer for a safe workplace. So while we applaud the government's actions to introduce Bill 168 and to address the workplace harassment and violence that we seem to have each and every day, unfortunately, our recommended amendments will ensure that threatening statements and behaviors such as stalking at the high end of the spectrum of workplace harassment are covered under the legislation. Without this amended definition, this legislation will not help to prevent tragedies like which was inflicted on our nurse, Lori DuPont. With these and the other amendments that I have put before you in our written submission, it is our opinion that Bill 168 will be better able to meet the government's intention of meeting workplace safety from violence and harassment, so that we, the nurses of Ontario, can take care of our patients and provide them quality care. Thank you very much.
30 seconds aside, Mr. Hillier or Ms. Jones.
Yeah, I just want to thank you for your presentation. You've given us some very specific amendments that we can look at and try to incorporate. So thank you.
Thank you, Ms. Jones. Ms. DeNovo.
Thank you, Mr. Chair. Lori's mother was here, as well as Teresa Vince's daughter, testifying before this committee. We're certainly going to be putting forward amendments that match yours. Thank you again for your deputation.